Please welcome to the stage AFTD CEO, Susan Dickinson.
We got to call people back in for lunch. Make it sound exciting in here. There you go. Thank you. Thank you. Thank you. Welcome back. I hope everybody had a chance to connect, relax a little bit, unwind, make some new friends. We know that that's one of the most important parts of these days that we have together. It is my honor to present an update on our work over the past year. And I would just start by saying we know that many new people are joining us for the first time, both in this room and out there, joining us from home or your offices. I want to send a special welcome to you first-timers and add that at our core, AFTD's goal is to create a community that understands. We want you to know that no one on this journey is alone. And together, we're working to build a future that includes better support services, effective treatments, and even a cure. Where do I point this? There we go. So AFTD is a 501c3 nonprofit organization. We were founded in 2002, and from beginning, our mission has been to improve the quality of life of people affected by FTD and to drive research to a cure. We envision a world with compassionate care, effective support, and a future free of FTD. We have one office located outside of Philadelphia, Pennsylvania, but increasingly, we're very pleased to be operating nationally and even internationally. We're led by a volunteer board of directors from across the country. We're guided by volunteer experts, and the work is carried out by staff and a network of wonderful volunteers across the country. Everything AFTD does is guided by robust strategic planning. Currently, we're 1 year into a strategic plan that the board approved last spring and that many of you informed. I invite you to find the plan on our website under About Us. But over the next few minutes, I'm going to walk you through the 4 priority areas that we put into this plan and share a handful of specific themes that are guiding our work in this plan, as well as highlighting some of what we've accomplished in this first year. So the first priority area is advancing diagnosis and treatment. AFTD has been awarding research grants since 2008. Over the past 7 years, we've awarded more than $15 million for scientific grants, and we're especially proud that we work in collaboration with several other nonprofit partners and have leveraged our own investment with nearly $9 million additional dollars from these partners. Some new aspects in our research grants in recent years. In addition to funding pilot grants for basic and translational science, we started to fund something called Well-Being in FTD grants. These support research to improve access to high-quality diagnosis, care, support, and research participation opportunities. Later this afternoon, you all will have the opportunity to hear from Dr. Allison Lindauer, who's a recent recipient of this Well-Being grant. Also, thanks to generous support from the Holloway family, we've been able to expand our support for a new generation of scientists and clinicians dedicated to FTD. We currently award 2 postdoctoral fellowships each year, as well as a clinical research training scholarship, which aims to train early career investigators in conducting clinical research in FTD. One of the themes of this strategic plan revolves around the unique place that AFTD has at the hub of this community and the role that we realize we can play in advancing research not just by funding, but by convening, collaboration, and consensus building. And along these lines, new this year is a FTD Research Roundtable, which is an opportunity for biopharma companies to share their challenges and set the agenda for how to work together in the pre-competitive space. I'm pleased again that we've invited a number of other nonprofit groups to join us there, as well as the FDA, who will be participating. And again, thanks to the vision of Kristen Holloway and support of her family, we have started something called the Holloway Summit, which was her vision. And the idea is that every year in an intimate setting, designed to promote collaboration across academia, industry, nonprofit partners, we can tackle a specific topic to advance the science. Last year in our inaugural summit, we focused on digital biomarkers, so think Fitbits or your Apple Watch. During COVID, we know that it was really pointed out to us that a lot of people couldn't get into the clinic, and there was no way to follow them to continue the research studies. The use of these tools is also really key in the strategy to broadening the population of people who can participate in research. It's an important priority as we work to include more diverse populations of people not near or perhaps not able to travel to major medical centers. And I'm very pleased that one of the results of this meeting is a RFP for $750,000, which is being co-funded by the ALS Association to advance digital biomarkers for FTD ALS. We'll be issuing that RFP later this month. Another theme is building a community of empowered and engaged research participants. You in this room and online provide a vital perspective that you have to share that can inform both research design and government regulators. You've heard from Dr. Miller earlier today, there's incredibly exciting momentum right now. We have 6 disease-modifying trials currently in the clinic for FTD, and we have more in the pipeline. People diagnosed and those at risk need to be key partners in ensuring that these trials are successful. And one of our key initiatives to making this happen is the FTD Disorders Registry, which is another nonprofit which AFTD co-founded in partnership with the Bluefield Project. Our mission is to advance research by promoting and supporting research participation, by sharing de-identified information with researchers, and by amplifying the voice of people diagnosed and their families who are living with this disease. This year, I'm very pleased to share that we're investing in a major expansion of the registry platform, which will enable us to collect more robust data from international sources. So this is a critical tool that will ensure that this community retains ownership of our own data and ensure that that data is used effectively and responsibly. There's a table out in the hall, which Swetha Reddy, one of the Disorders Registry staff is staffing, and I really encourage everyone to stop by her table and join the nearly 6,000 people from around the world who are already partnering with us to advance research through this participation. Another strategic theme is educating health professionals to ensure that more people have access to accurate diagnosis and knowledgeable, appropriate care. I'm thrilled to report that this past year we began offering CME and CEU credits for professionals working in this space. So far, we've produced 2 programs for physicians and 3 for nurses and social workers. All of these are available for viewing on our website, although right now to get the credits, you had to watch them live. Over the coming year, we plan to continue to build out this library, and we do look forward to offering asynchronous credits. Priority area 2 is advancing quality care and support. Our themes here are both scaling the programs that we know work well, and broadening our research so more people from different communities, backgrounds, and geographies can access the information and support that we have to offer. So our website content is available in a total of 8 languages now. And we have 3 professional social workers who man our helpline, which means they can take more calls and respond to your questions more swiftly. And finally, thanks to donors, we're funding more Comstock grants than ever before for respite, quality of life, and travel to conferences like this one. We're also very pleased to see more people connecting with us on social media and through our supportive Facebook groups. Whoops, I didn't advance, I apologize. That was that slide. Another new strategic theme is informing and supporting families with concerns that they may have a genetic variant or indeed know that they do. I'm pleased to say that about 6 months ago, we hired our first manager of genetic initiatives. Kim Jenny is here and available to talk to people. And through her work, we are already providing more information, but we hope to implement new programs that provide more supportive environment for these families and enable them to participate in research. Other new resources include our email newsletter, Help and Hope, which is now offered weekly, real-time translation for callers to our helpline, which makes the service accessible to people in different languages, and a new checklist that can be downloaded from our website in English or Spanish. One side, you fill in the symptoms that you may have been observing. You take it into your doctor, and on the other side are the actual diagnostic criteria that Dr. Miller was sharing with us this morning. So this is a critical way that hopefully people can get diagnosed faster, and also we're going to be educating those clinicians in this way as well. I'm really excited to tell you that since we created those checklists in September, they've been downloaded more than 20,000 times. Another checklist, again, which you can download, which kind of provides a guide for people dealing with the new diagnosis and walk you through the decisions that need to be made, has been downloaded more than 800 times. On to priority area 3, which is about awareness and engagement. A strategic theme here is addressing and empowering our community to advocate for and drive change. This is going to enable us to address our 5th and final mission pillar, advocacy. So over the coming year, we'll be identifying key issues and developing resources and tools for volunteer advocates to engage around policy and legislation. And across our mission, as ever, it's our wonderful army of volunteers who guide, fund, and inform our work, and who deliver our information, our services and materials to local communities and medical centers. Many of you are here today, and we want you to know how deeply we value your partnership. We could not deliver our mission without you. So as with any rare disease, awareness is foundational to everything we want to accomplish. And as I'm sure everyone in this room knows, on February 16th, the Willis family announced that Bruce Willis has been diagnosed with frontotemporal dementia. Now, those of us in this room and participating online would be the last people to wish this diagnosis on anyone. Yet at the same time, we've been very aware that the fact that FTD didn't have its Lou Gehrig or its Michael J. Fox made awareness challenges even harder. So we were incredibly honored when the family came to us wanting to partner with AFTD to make the announcement on our website. And indeed, because of their generosity in sharing their story, we're seeing that they've already had a huge and immediate impact on awareness. And I have just a couple statistics for you here. What you see here is the fact that in the 2 years prior to making the announcement, we had a little over 910,000 unique visitors to our website. And in just the 40 days after the announcement, we had 1.3 million. This means far more people connecting with AFTD, with our mission, and getting the accurate information about this disease. Another fun way to look at this is the different countries where people were visiting from us. So again, the prior period here is the 6 weeks before the announcement, and then you see in blue the number of visitors from each country in the 6 weeks after the announcement. Honestly, we wonder if this reflects where Bruce Willis is the most famous and most beloved in different countries. You can see he has fans around the globe who really care about him. And the result is, again, around the world, more people are getting accurate information about this disease. So Emma Hemming Willis and her family have already done so much to raise awareness, and they've been making strong connections to the FTD community. Emma wanted to be here today, but she had a personal conflict with another family event. So she asked me to share this brief message with you. An AFTD diagnosis is so hard on families, but you need to know you aren't alone. There are others in this community who understand so much of what you're going through. There are others further down this path who can help. Take the chance to connect with others who understand today. Doing that has made such a difference for me in this journey already. And Emma, if you're watching, we just want you to know how much we appreciate the generosity of sharing your family's story, such a personal one, but as we've seen, you're already making a big difference. And then I just wanted to point out to everybody that there is another major awareness opportunity later this year. As ever, the last week in September is World FTD Awareness Week. You'll be hearing more from us about the activities, but it's an incredibly important week where advocates from around the globe in many different countries come together to share the message and make sure that people in each of those countries start to learn that not all dementia is Alzheimer's, and that sometimes it can happen in younger people, as everybody in this room well knows. So the final area is infrastructure, turning into making sure that AFTD is strong. And what we know is that even after we get that coveted first approval of an effective drug from the FDA, there's still going to be so much more work to do. So our board puts emphasis on the core strength and sustainability of the organization. I'm really pleased and grateful to be able to say that with strong donor support, today AFTD has 45 staff. We're going to continue to grow a bit more. All of my employees have had some role in what you're experiencing today, and many of them are in the room and behind the scenes here. There's still others back in the office helping to support the virtual experience. And we want you to know that we all just greatly value the opportunity to connect in person at these conferences. And I hope you'll leave here feeling more connected to this hardworking staff and board and all the dedicated volunteers who bring such a deep connection to this work. So as I said in the beginning, at our core, AFTD is about creating a community where people can find understanding and support, and hopefully participate in research to build that more hopeful future. One theme you'll hear today is that every FTD story counts. FTD stories need to be told, despite and perhaps because of the current stigma of a dementia diagnosis. So whether you're a care partner, a person diagnosed, a family member, a friend, or a healthcare professional or researcher, it is important that you share your perspective on FTD with others around you. This is a pivotal moment in public awareness and research momentum, and there is power in your story. AFTD is here to be a partner and a resource to help get your story told. Thank you.